Local healthcare providers are raising concerns about possible changes to abortion access in South Carolina. A bill at the State House would prohibit all abortions with no exceptions for rape or incest. Our Claire Weber spoke with a local OBGYN who has concerns about the impacts these changes may bring. Claire?
Tessa, sponsors have named this bill the Human Life Protection Act, and they say that is their ultimate goal. One representative says it would stop people from using abortions as a form of birth control, but doctors say there are big risks.
When we got word that the pregnancy was no longer viable, it was devastating.
South Carolina's 6-week fetal heartbeat bill passed in May 2023. That same week, Kelly Sharkey learned her pregnancy had severe health complications. But the procedure she had scheduled was now at risk.
Hearing her say that the hospital's lawyers were not allowing her to continue doing this procedure, it was just confusing. It was surreal.
Sharkey was forced to fly out of state alone to have the surgery in Maryland. She says sitting on that plane was one of the darkest times in her life.
I was carrying my baby who was dying, and being alone was really hard. And it took me a while to even be okay with even getting on an airplane again.
Under a near-total abortion ban, Dr. Natalie Gregory believes cases like Sharkey's will become more common. The bill only outlines exceptions for medical emergencies, but she says it provides no definition of what qualifies as one.
Sometimes we don't have time to wait an hour to ask somebody, much less a couple of days for attorneys to hash it out.
Dr. Gregory says delaying care for a legal opinion or forcing a patient to carry to term can bring more complications for the woman and fetus. According to the State Department of Public Health, South Carolina ranks 8th highest for maternal mortality in the U.S. Dr. Gregory argues this could worsen under tighter restrictions.
I've personally had patients that have sat in the hospital for days on end waiting for a meeting to happen behind closed doors to figure out if they're going to be given the medical options that they have to take care of their complicated pregnancy.
The bill currently has nearly 40 all-Republican sponsors. It hasn't moved out of the House Judiciary Committee. Claire Weber, News 4.